yourself.
Hi, my name is Dr. Abdullah Saeg. I work as a faculty in the University of Toledo Medical Center.
So, you've worked in Iraq before?
Yes, I did.
Can
I
you-
worked there from 1997, the year I graduated from medical school, until 2003.
And
And that is in the medical field. And then from 2003 to 2005, I worked for the International Committee of the Red Cross in Baghdad delegation as well.
Hello, Dr. Yassin. If you could please just tell me a little bit about your Arabic background.
Well, I was born and raised in Saudi Arabia in a little city called Abha out in the mountains. And then a few years later, I moved with my family to Carbondale, Illinois.
Oh, so you're a Saudi national?
No, I'm not actually. My family's originally from Syria. I have, my ancestry and my grandparents and my parents are all from Syria.
Oh, okay. Do you know what part of Syria?
Yeah, actually, we're from a city called Latakia. It's all around. It's known for its beaches.
What is your name?
My name is Mark Benoub. My birth name is Munir. That's a Middle Eastern name, but after I came here, I adopted Mark for ease of pronunciation, and it fits better interacting with people from this side.
Where are you originally from?
From Egypt.
In Alexandria, too.
Yes, Alexandria.
And what schools did you attend to get your degree?
University of Alexandria, Faculty of Medicine,
What practice of medicine are you in?
anesthesia.
How long have you been practicing medicine?
25 years.
Both here and there?
I came right after school.
You've been in the United States for 25 years now?
While you're still practicing after training, I came here full time in 1986. So it's been a little over.
and how's it different from working here?
The system is different, I would say. The medical knowledge is more or less is the same, but the system, I used to work as a resident in both hospital and outpatient setting, in addition to an ER coverage as well. In the first couple of years as resident in Iraq, it's kind of a comprehensive one in which we have to practice in all different types of branches of medicine, versus here in the US, you have to pick up a certain branch to serve as a resident and then get the training. And then after that in Iraq, we can pick up any specialty and then get more training.
So, how many years then was it in Iraq residency?
Total, I would say 8 years.
Wow.
From 97 to 2005. The last couple of years when I worked for the Red Cross, I wasn't doing any clinical job. I was working mostly administrative jobs within the medical department and the ICR.
When you went to England, how was it different? Do you feel like there was culture problems dealing?
No, for me it was again, the lifestyle is different from Iraq, but for me there was no cultural conflict or cultural difference. People were very nice, and at the time when I left Iraq, it was very chaotic, and right after the 2003 war with a lot of violence, so I found a lot of serenity in England. In England, there is more system and there is more organization, definitely, than what was there in Iraq.
All right. Well, thank you.
Could you tell me a little bit about your line of work?
Well, I am an emergency medicine physician, and critical ill patients.
Okay. Can you tell me how do you utilize your Arabic background, like your language and skills in your line of work?
Well, I usually use it every day. Toledo, Ohio is known for its huge population of Arabs here, and there's a lot of people here that actually don't know English. You'll be actually surprised, and when they do come into the emergency room, and they don't know, and they're having a heart attack, I have to ask them questions so I know what kind of medications to administer and to get them back to health and as fast as I can. So I use it pretty much every day.
Are there any cons to having an Arabic background in your line of work?
I don't think so. I don't think there's really any cons. I think being an Arab and being American is a huge part of who I am.
Right. Thank you so much.
Did you always want to practice medicine in the United States, or did you decide?
I always knew I wanted to come here. It's a better medical system, better economics, better future.
And what would a normal day look like for you? I know you mentioned it's a 24-hour shift.
Yeah, well, I think work days for anesthesia are, well, very depending on your best practice, but most of the time we'd get up around 5:15 in the morning. You usually try to be at work, getting ready at around 6:30. Most surgeries start around 7:15 or so. And depending on the call schedule, you may go home on a normal day where you're not on call or after call. You probably work until 4 or 5. And if you're on call, depending on the setup, you may spend